page 3, see where it says stain, action, function, and all that. I want to talk about, I'm not going to go over every one of these stains, and I'm going to cover these really quickly because you're going to hear this again in the program, but I want you to just kind of start getting used to hearing certain stains. You don't even have to worry about how they're done, nothing. I just want you to know the purpose of it, okay? Just the purpose of the stain. There is a stain that sometimes, I've never did it in urinalysis, but there's a stain that you can use that's called 2% acetic acid. This is the third one down in that box, okay? Just skip the first two. But the third one down is 2% acetic acid. I think it is very, very important because it helps. The only reason they'll put this on a slide is it helps to distinguish what a red blood cell looks like between yeast. Because yeast and red blood cells look very similar, okay? So there is you can add a drop of like a dilute acetic acid, and what it'll do is it will lyse red blood cells. And if it lyses red blood cells, it lets you know that you're looking at yeast, right? Because all your red blood cells are going away, all right? That's a stain that I'm only picking the ones that I could possibly see you may be coming and encounter with your urinalysis laboratory. The next one says oil red O and Sudan 3. This is a stain that when I worked, we used this in stool specimens to detect what's called fecal fat, okay? But at this point, I just want you to know, if you ever see the word oil red O or Sudan 3, it is a stain that is used to detect fats. Yeah.
Would that be like steatorrhea?
Yes. But you see, you know, again, it's picking up things like triglycerides and cholesterol, any type of fats. The gram stain, no, I don't want to cover that. That's micro, and I don't even know if they do gram stains on urine sediment because there's so much stuff in it a lot of times. The Hansel stain. If there's one stain that I think that they will ask you about, it's this one. There is a stain called a Hansel stain that they will do on urine sediment. Basically, you make a slide the same way I told you about. You spin down the urine, you get the sediment, you put a drop of it on a slide, but now you let that slide dry. Okay, you let the stain like gel and dry on top of it. When we're looking at urines, we want it in a liquid state. You see what I mean? We want it in a liquid state. So there's a stain called a Hansel stain, and the reason that they do it is it's trying to detect urinary eosinophils. Remember, when we're looking at sediment under the microscope, all we're saying is if it's a white blood cell or not. We have no idea if it's a seg, if it's a basophil, okay, see what I'm saying? We don't know. All we know is it's a white blood cell. But there is a stain, again, called a Hansel stain that will show eosinophils. And your book has a good picture of one. I'll try to stop when I see it and show it to you. The other one down is a Prussian blue stain, and you may have remembered that from hematology. Prussian blue is usually used to detect iron in something. It's an iron stain. What I remember that I actually used in the lab is we did a Prussian blue stain on bone marrow slides to detect iron in the bone marrow. But evidently some places can detect iron in the urine sediment as well, okay? So again, if you see the word acetic acid, differentiates red blood cells from yeast, okay? If you see the word oil red O Sudan 3, think lipids, think fats. Hansel stain, think urine eosinophils for Hansel, and then for Prussian blue, I want you to remember the word iron. All right, page 105, under cytodiagnostic urine testing. On page 105, toward the top in the left-hand column of purple bolded word there, cytodiagnostic urine testing. The very last sentence of that paragraph says the urinalysis laboratory should refer specimens with unusual cellular findings to the pathologist for further information. And this is called cytodiagnostic testing. So what I mean, and when I say that, I'm not even going to ask you to identify it, but after we get through talking about all this stuff today, if you see cells in the urine that are like a little bit larger than a white blood, let's say a white blood cell is that big, but you see a cell that's a little bit bigger, this has got like granular content in it, you'll know it's a white blood cell. But if you see some cells that start looking like this, okay, That's what I call a mononuclear cell, all right? The closest thing that we'll call this, and we'll talk, is called a renal tubular epithelial cell today. And a lot of times that's seen in like what's called tubular necrosis. It's like bad, bad, bad. You don't want to see them. But if you see what's called a mononuclear cell in the urine specimen, a little bit bigger than normal, you want to refer this to what's called cytology or pathology. You want somebody looking at it that's got a higher degree than you do, okay, that's an MD, because this could represent a tumor cell of the kidney, okay, some sort of a type of cancer, tubular necrosis, things like that. So you would definitely want to look at that, all right?
If I hear, tubular necrosis, am I thinking, degradation of the nephron?
Yeah, you're thinking end-stage kidney failure or acute renal failure. But there is just trust me, make sure you have that highlighted, all right? Now, I can honestly tell you, in the 11 years I worked, I don't think I ever referred a urine specimen to pathology, ever, okay? Because it wasn't because I was that good, it was just because, for whatever reason, those are really rare to see that. But that doesn't mean that it won't be the very first slide you look at when you become a tech, okay? So just know that you do have an outlet for things that are what I call above my pay grade, all right? But it won't happen often. If you're working in urinalysis and you end up referring 4 specimens that day to pathologists, you're in trouble, okay? You don't want to do that, but it is something that can happen from time to time. All right, on page 105 in the right-hand column, it's hard to find this, but just go to the right-hand column, just try to go about exactly halfway down. I'm in the middle of the line, but it starts with the oculars. It says the oculars are designed to further magnify the object that has been enhanced by the objective for view. Lab microscopes normally contain oculars capable of increasing the magnification 10 times. I have to include things about the microscope on this exam, okay? So, because of that, there's going to be certain things I'll refer you to, but I'm not going to spend a lot of time going over, because I think you guys are already past the parts of the microscope and stuff, right? Like if I tell you the stage of the microscope, we don't really need to go over that, I'm hoping. Page 106, left-hand column. We've already talked about this today, but I still want you to have it highlighted as a study guide. I'm on page 106, left-hand column, the very last sentence. It says the 10 biocular and the 40 power objective provide a magnification of 400 for high power field observations. That would be the total magnification for high power field. You know, when you're reading this chapter, you're gonna read across stuff called Kohler illumination, all the different types of microscopy. The types of microscopy that we're gonna do in this class, we're gonna do something called bright field microscopy. It's on page 107 in the right-hand column. Bright field microscopy. It's gonna take up 99% of what we do in here. But I do want you to also understand there's something called polarized microscopy, all right? But I've never looked at a polarizing microscope, but what you can do is you can make a modification to a bright field microscope. You have what's called these little polarizing lenses. They're little glass things. I've even got them in our lab, okay? And you can hold one eyepiece like right in between the ocular that you're looking at in your eye, and then one eyepiece in between the light source of the microscope and the actual stage, and you can kind of turn them like that. And that specimen you're looking at is known to polarize, like certain crystals, like uric acid crystals and lipids and things like that, polarized light. You'll see all these pretty colors flash at what you're looking at on the scope, okay? So, if you read over bright field microscopy. Anything other than bright field microscopy, you shouldn't be held for as far as your exam. We're getting close to actually talking about the stuff we're going to see. Do you guys have any questions about the microscope? and I'm not trying to embarrass anybody, how many of you in here feel like you're really, or you feel like you're proficient? If I was to put anything in there, gram stain, whatever, hemocytometer, do you all feel like, for the most part, that you're getting comfortable looking at the microscope? Are there any of you that get mad? You're just like,
I think it's a focus thing with those, because that's different than the ones that I use in the lab. I mean, I think it's the same concept, but they're different.
Yeah.
But I'm working on it. I was
Yeah.
able to get myself focused yesterday.
yeah, and that's good. That's something Jason and I talked about. We can't, all microscopes are different. And about the time you get really good at these, when you go to clinicals, they're gonna have a different brand of microscope. It's still the basic principle, but you're not gonna be as good on a different kind as you get when you're on these, okay? I hated these when I first saw them, because I was used to having really good microscopes in the lab, and when I was dealing with those, I was about ready to just pull what little hair I had out, okay? But now, I mean, I feel like I can get them quick, so understand that. Don't get too frustrated, but at the same point, all microscopes are built the same. Okay, yeah, one of them may have a knob over here, and the last one you were working at, that same knob is on the other side, but they all have so many things in common. The objectives, the eyepieces, the stage, okay, the light source. We're one of the only labs that have microscopes where the side lights up with blue lights. That is for the instructors, because if, like, when we're doing microscopy in there, I'm having all y'all look at the microscope, that way I can look across the room, and if I see that Brooke's having a little bit of trouble, I can tell by how many bulbs are on her light from way across the room if she's using the right amount of light, or more than likely I can, okay? So anyway, sometimes to get proficient on those microscopes takes you guys working one-on-one with me or Jason. The bell may not go off while we're in there as a class. Sometimes you may have to go in there on your own, and you guys are all welcome to do that. Get a microscope out, get with me or Jason, and we can throw like 5 different slides at you. Hematology slide, a urine slide, and all of that, gram stain, and we can work with you on how to get stuff in focus. And I'll work with you as much as I can in class, but sometimes with a group, it's harder to, like Tanner may be having one issue with the scope, and if I can get with him individually, we can knock that out, and then he'll be good to go, okay? So don't be afraid to ask us for help one-on-one with the microscope, but you gotta ask. I have seen a student slip between the cracks before, and they finished this program. They were not good on microscope after I was told clinicals. So don't just try to get your way through it. Be honest with yourself. I used to get freaked out because I'd see my eyelashes. You ever do that?
Yes.
Eyelashes and all of a sudden it looks like a big granddaddy long leg coming at you or something. So it just takes some practice. All right, so now we're gonna get down to the nuts and bolts of microscopy, and we're gonna talk about things and what they look like. So if you'll turn to page 110, urine sediment constituents. Left-hand column, page 110, says a normal urine sediment may contain a variety of formed elements. Even the appearance of small numbers of the usually pathologically significant red blood cells, white blood cells, and cast can be normal. It also says that you can see things like epithelial cells and mucus strands. Toward the end of that column, toward the bottom, about 5 lines up, it says commonly listed values include 0 to 2 or 3 red blood cells per high power field. That means 40. 0 to 5 to 8 white blood cells per high power field, and 0 to 2 hyaline cast per low power field. So I just don't want you guys to think if you're looking at your own urine and there's something, you see an occasional red blood cell or something, that does not mean that you're sick, okay? You expect to see a couple of things, but you don't expect to see, say, 5 to 10 per high power field, all right? So the first thing we're gonna talk about is red blood cells. I'm in the right-hand column on page 110. There are 2 pictures on this page of red blood cells. The first picture, the first box on top, figure 6-pack 8, that's what normal red blood cells look like. And figure 6-pack 9 show microcytic and crenated red blood cells. Now, I'm gonna refer you to a lot of these pictures, and I have totems, and I'm gonna show you all of that stuff in lab, but there's some of these pictures that I really like, that I think look exactly like what you'll see, and that I'm gonna point you to, and it may not even tell you about it in the book. But I want you to look at that box before we go any further. I want you to look at figure 6-pack 9. Okay? You guys agree that you see all the little bitty circles in that picture. Those are red blood cells, and that's exactly what red blood cells will look like. But do you see how some of them are kind of turned over on their edge, and they're not all gonna look exactly alike. But pretty much every circle you see in that picture, except for about 2, are red blood cells. But I want you to look at that picture, and I want you to look in the very center, the very dead middle of that picture. You'll see a cell that looks larger than the other ones. Now, the picture's not even referring to this, but it's something, as an instructor, I want you to hone in on. That's a white blood cell. And the reason I think that picture's so important is because you're seeing a red blood cell right next to a white blood cell. That's gonna be about the difference in size that you're looking at, okay? It doesn't say anything about it in the picture, but I do want you to understand that, okay? So, under red blood cells, I'm in the second paragraph under the red blood cells. It says, in concentrated hyperstenuric urine, the cells shrink due to loss of water and may appear crenated or irregular. Then it says, in dilute or hypostenuric urine, the cells absorb water. They swell and they can even lyse, releasing their hemoglobin and leaving only the cell membrane. These large empty red cells are sometimes called ghost cells and can be easily missed if you're not looking at that specimen in a reduced light. Okay, so here we go. We got a normal red blood cell, okay? We've got a crenated red blood cell. And we can, I'm just trying to draw this so you can kind of imagine it. We can have what's called a ghost cell. Imagine that's even lighter, okay? In other words, we've got a red cell that's starting to swell up because there's a lot of water in the specimen, okay? That's a hypotonic solution. This, I want you to represent this as normal, and then this would be a crenated red cell that's in a real concentrated urine. Let's say the specific gravity on that specimen is about 1.030. That's getting up there, okay? So you can see red cells, they can appear different, but you gotta be able to recognize them as red blood cells.
Would the ghost cell look a lot like the white blood cell?
All you're seeing on a ghost cell, you're just seeing the outer remnants of this membrane. You see how I tried to make it a little thinner, the membrane?
Yeah.
It's just real light, okay, the outer remnants, and they usually look a little bit larger than a red blood cell because they're starting to swell.
But they're easily distinguishable from the white blood cell.
Yes, yeah. There's a key thing that you'll be able to tell a white blood cell, because they have, a red blood cell doesn't have anything in the middle of it. There's no nuclear material or nuclear content. When we talk about the white blood cells, they're gonna be about the size, they're gonna be like this, but they're gonna you're just gonna see flakes of stuff in there. You know what I mean?
Yeah.
And it's nuclear remnants.
Yeah, this is
You will not be able to tell whether it's a seg or a lymphocyte or a monocyte. Now, if you look really, really close, sometimes you can see a white blood cell and you can actually see the nucleus kind of, you know what I mean, like that. But you have no idea whether that's a basophil or a eosinophil or a segmented neutrophil, because there's no stain in this at all whatsoever, okay?
Like that. Yeah. I just want to follow different statements. It's just a different. Yeah, sometimes like I'm sure they take a picture and it just has a different color.
The last paragraph on page 110, go down about 5 lines, and it's gonna say, red blood cells are frequently confused with yeast, oil droplets, and air bubbles. You may not be tested on that, but that's real important to understand that, because if you see something and you're like, I kinda think they're reds, but they don't really look right, you just need to understand there's other things that can kinda look like red blood cells and you don't wanna get them backwards. Trash, an air bubble in the, I mean, I've seen texts before where they go, man, I don't know what this is. I'm like, it's air bubble, you know? And then, again, yeast, just there's certain, what I call trash, yeast isn't trash, but like trash that could confuse with a red blood cell. You've got a picture on page 111 and figure 6-11. that shows you what an oil droplet looks like. Do you agree with that little arrow's pointing to in figure 6-11? It looks kind of like those things in figure 6-8. Do you not agree? Okay, but that is not a red blood cell. But what should give it away is the real large one that's right beside it. And they both look the same except their size is different. Figure 6-12 shows an air bubble. Now, you know, these pictures in the book are okay, they're okay pictures, but after you go home and do Google Images and Yahoo Images, and after I start showing you Kodachromes of all, I'm gonna show you red blood cells every way that we can show them, okay? You will get a good grasp of what a red blood cell looks like and the different appearances it can come. All right, page 111, right-hand column. Clinical significance. It says the presence of red blood cells in the urine is associated with damage to the glomerular membrane or vascular injury within the genitourinary tract. It goes on to say in the next paragraph, about halfway down in it, it says macroscopic hematuria is frequently associated with advanced glomerular damage. And the very last paragraph on page 111 says the observation of microscopic hematuria can be critical to the early diagnosis of glomerular disorders and malignancy of the urinary tract and to confirm the presence of renal calculi. You have somebody that comes to the ER, okay, they're having pain and they think that they may have a kidney stone or a renal calculi. One of the signs of that is there will, like when you look at the urine, it's not gonna be pink and cloudy, it's not gonna be red and cloudy, it may look yellow. And when you spin it down, you don't even see a red button. But when you look at it underneath the microscope, let's say maybe a red trace for blood on the chemical exam, when you look at it underneath the microscope, maybe you're seeing maybe 5 or 6 red blood cells per high power field, just enough, okay, to make it a little increased. That's the sign of a kidney stone, okay? So you can't miss that, because that physician's looking for that result. They're saying, okay, I want you to think about that kidney stone moving just a little bit, just enough to cause a little bit of blood, okay? And that's an indication. Now, I've also seen other people that are in the ER with kidney stones and their urine comes to the lab and it's bloody, okay? I mean, red blood cells everywhere. But the point is, you've got to recognize red blood cells. Like if there's just a few, you still need to account for them. Also, always keep in the back of your mind, although you're not the physician, menstrual contamination can cause blood in the urine as well. All right, next cell, let's talk about white blood cells on page 112, left-hand column. It says white blood cells are larger than red blood cells. Don't worry about how large they are as far as the 12 millimeters. You've got some pictures all on page 112 and 113 showing white blood cells. I think picture A is the best picture there is, okay? You see every circular cell in that picture is a white blood cell, okay? Can you tell the difference between the red blood cells we looked at? The red blood cells are pale, you know, they don't have any like nuclear chromatin anywhere. Picture B, that's a lot of white blood cells. I mean, like me just looking at it, I'm thinking 10 to 25 the minute I look at that picture, right? You guys agree with that somewhat? Figure 6-16. Well, let's look at figure 6-17 first. See, those are called Hansel stain eosinophils. But remember, an eosinophil will never look that way under just looking at urine sediment as is. See, we don't put any stain or anything on our urine microscopics. To make those eosinophils have those little pinkish red granules in it like you're looking at in that picture, a Hansel stain has to be performed. Now there is something that is called a glitter cell. Ooh. All a glitter cell is, and the book can't give you an understanding of this, but I want you to think about something. If I have a white blood cell and I've got this nuclear content in there, okay, and I have seen these working in urinalysis before. If you look at these underneath the microscope, there's something that can happen sometimes to where I swear, it's gonna look like it is just covered with bacteria, all right? And that bacteria is even moving. I mean, you can just see all these little dots on top of the white blood cell that you're looking at, they're moving. It's called Brownian movement, and it has nothing to do with bacteria. All you're seeing is you're seeing a white blood cell that is starting to be exposed. It's becoming a little bit hypotonic, kind of like the red cells, and they're starting to swell up a little bit, and it's called a glitter cell because the little nuclear remnants, there's little spots that start just reflecting. It's like real pretty. It's really not even significant. It's just stating that the white cell is getting close to busting. That makes sense?
Yeah.
It's called a glitter cell. You got one on there?
Yeah.
I hope that's what you're all
Yeah,
looking at.
no, yeah, because I found
She's
one
got
on
a book
YouTube.
on here. That
Yeah, it's
forgot
called
my book.
Brownian movement.
It's actually really
But yeah,
good.
because I've got one right here on YouTube,
Check that out.
and you can see all the little specks.
And that's what I'm hoping you guys do, all right? That's what I'm hoping y'all do. I'm hoping you go home because you'll see this stuff. It's just like here in a minute, I gotta start talking to you guys about trichomonas, but I can't show it swimming on the book. Okay, the trichomonas swims around in the urine and it's got a big long tail that's whipping.
If you don't pay attention, you'll see the tail whip, and then you'll be like, oh, yeah, there's the,
And all of a sudden he goes.
there's the rest of it.
But if you'll go to YouTube, because I do it all the time, go to YouTube and just type in trichomonas in urine specimen, and you'll see them swimming around. And then when you see it, it's all gonna hit home about what I'm trying to explain to you.
Yeah.
And yes, I could show those YouTube videos up here, but we're not gonna be able to go fast enough if I did that.
Yes, sir.
So I'm thinking you'll do that. All right, so white blood cells. You can have different types of white blood cells. It mentions the eosinophils and the Hansel stain on page 112. Then it talks about the mononuclear cells. It talks about anytime you see mononuclear cells, you need to refer that to cytology. All right, I'm in the right-hand column on page 113, and let's talk about the significance of white blood cells. 113, right-hand column, it says usually fewer than 5 leukocytes per high-power field are found in normal urine. However, higher numbers may be present in urine from females. Skip about 4 lines, and it says an increase in urinary white blood cells is called pyuria, and indicates the presence of an infection or inflammation of the genitourinary system. And then it goes on to talk about, you know, depending on how bad it is and everything, you can have a common urinary tract infection. You can have an upper urinary tract infection, like of the bladder itself. That would be called, like once it starts getting up in the kidneys, pyelonephritis. So just make sure you read over that section. It's telling you the significance of seeing white blood cells in the urine. Okay, page 114, we're gonna talk about epithelial cells now. Epithelial cells. 99% of the time, if you see an epithelial cell, this is the one that I used to tell y'all in the intro class, kind of looks like a cloud, all right? Thing you need to think about right now, okay, that's what he said, focus the microscope on. This is squamous epithelial cell. They're pretty much normal, okay? They're found lining the urethra, but they can also be found in males. So you don't just see them in females, all right? You see them more in females, but they can also be found in males. This is known as a squamous epithelial cell. Again, it is totally normal. When I worked, we didn't even have any other options. If you saw one, they were just called epithelial cells, and we didn't categorize them. But in the book, there's different types of epithelial cells. There's squamous epithelial cells, which I've written on the board, and then in your book, they're going to mention one called transitional epithelial cells. It's a different type. Usually your book is going to tell you a transitional epithelial cell sometimes can be found in the urine specimen because you've had a procedure done, like a catheter put in or something like that, and some of those break off the lining and they actually will appear in the urine. Transitional epithelial cells and squamous epithelial cells pretty much just take to the bank, they're totally normal, all right? You'll see them and big deal, count how many, and they're not going to think much of it. But there is something called a renal tubular epithelial cell, and these are diagnostic. These are what you do not want to see, And these are the ones that I was telling you about that if I ever was to see one, I would refer that to pathology. Because usually if you see a renal tubular epithelial cell, it indicates tubular necrosis, like your tubules are affected, they're really, really bad, they've been damaged, there's been a traumatic injury or something like that to occur. Okay, let's glance at some of these pictures. In my opinion, the best picture in this book of a squamous epithelial cell is on page 114, figure 6, tac 19. It's got a lot of different things listed, but see the squamous epithelial cell in that picture? That's what they'll look like. That is a real live urine picture that you're looking at, and that, from all the time that I work, that is what you see more often than not. Picture A on page 114, those are squamous epi, but I don't really like that picture. I really like picture B on 114, but that sediment, it actually has a stain that's been applied to it. I don't want you to think that squamous epis are gonna be light purple, okay? They won't be. They're gonna look like that picture I told you, 6 tac 19 down there.
Do they just do that for the photo, or?
We're gonna talk about, there are some labs that they have a stain that they can put on the urine sediment that actually shades things, and it makes them a different kind of a distinguishing color. We never had that. We just looked at them straight urine sediment, but they do have stains. Good question.
Are these cells usually bigger than your biggest of casks?
Nope, they're not as big as cast, but they're the biggest cell. Not as big as cast, though. Sometimes epithelial cells come in clumps. You see a clump of epithelial cells on page 115 and figure 6 tac 22. Figure 6 tac 24, now those, and I still think they look like epithelial cells, but those are called transitional epithelial cells. You see how close they resemble squamous epithelials, those transitional ones? But they have different forms of transitional epithelial cells. I'm not gonna make the test that hard. I don't wanna go so far into talking about one certain type of thing. Right now, I just want you to kind of be thinking, look, he said squamous epithelial and transitional are normal, but I better watch out for those renal tubular epithelial cells because those are bad, bad, bad. You don't wanna see them, okay? That's where I want you thinking right now. So you can read about the transitional epithelial cells. Again, it's gonna tell you that a lot of times you'll see them if a patient has had a medical procedure. Okay, page 116, let's talk about the bad boys. Let's talk about renal tubular epithelial cells. On page 116 in the left-hand column, says renal tubular epithelial cells vary in size and shape depending on the area of the renal tubules from which they originate. If you'll go down about 5 lines up from the bottom of that column, it says observation of an eccentrically placed round nucleus aids in differentiating them from the spherical transitional epithelial cells. So before we go any further, the best picture that I can show you that I think is what one truly looks like is figure 6 tac 29. You see those two round cells in the middle, but do you see how the nucleus is kind of offset in both of those cells? It's like not in the dead center. It's kind of positioned to the right, or it could be to the left. They're not going to be centered. Everybody with me on that? You see the nucleus? Okay, page 117, go up to the very first paragraph on page 117. Go down toward the bottom, go up about 4 lines from the bottom of that paragraph. It says the presence of more than 2 renal tubular epithelial cells per high power field indicates tubular injury, and such specimens should be referred for cytologic urine testing. In other words, send that to pathology. Under clinical significance, it says these cells are the most clinically significant of the epithelial cells. The presence of increased amounts is indicative of necrosis of the renal tubules with the possibility of affecting overall renal function. So now we're gonna talk about something called an oval fat body. Oval fat body, on the right-hand column on page 117.
They look ridiculous.
It says renal tubular epithelial cells can absorb lipids that are present in the glomerular filtrate. Then they appear highly refractile and the nucleus may be more difficult to observe. These lipid-containing renal tubular epithelial cells are called oval fat bodies, and they are usually seen in conjunction with free-floating fat droplets. There is a way that you can identify these by actually adding a certain stain and looking at polarized microscopy. So I want to direct you to two pictures. The first picture I want to show you is go over to page 116 and look at figure 6-28. That is a renal tubular epithelial cell that you're looking at, but do you see all those fat lipid contents that stick into the top of it? That's why it doesn't look like a renal tubular epithelial cell to you, is it has lipid content stuck to it, all right? So what we can do is we can put a fat stain on that, like a Sudan O or a lipid oil O, any of those stains that are used for fats, and we can look at it under polarized light, and oval fat bodies will have a distinguishing characteristic. You will see a Maltese cross appear on those, okay? And if you will, I think it's on the next page, or what it is. Look at page 118, it's hard to see, but look at that picture at the top and the arrow is pointing to the Maltese cross that you'll see.
Which one?
Page 118.
Page 118, turn over to the next page, you're looking at your
Oh,
hands.
yeah.
Can't really
Do
see
you
that.
see the picture to the right that you're looking at? Do you see the Maltese cross?
The light was glaring on it.
Okay.
Yeah.
Now look, you won't see that just adding a drop of urine to a microscope slide. You don't see that Maltese cross. You gotta do some special stuff to make that Maltese cross
Yeah.
appear, okay? In other words, you have to add a fat stain to it, and then you have to be looking at it either on a polarizing microscope or using those, remember those polarizing lenses I was telling you can use? And you'll see that Maltese cross appearance.
How do you know which color to look for?
Because what if you're looking, like if I put a drop of urine sediment on a microscope slide, and let's say I see something and I'm like, I know that's not a white blood cell, it's not a red blood cell, it's not a squamous epithelial cell, and I see all these, like that picture I showed you, and I'm curious and I'm thinking, is that a renal tubular epithelial cell that's got lipids floating on top of it? Now, if I'm suspicious of that, well, what I would do is refer to pathologist. But, okay, let's just say that I'm really wanting to find out and I've got time to kill. I would go get some polarizing lenses and I would add a fat stain to that specimen and see if I could see that little Maltese cross when I looked at the polarizing lenses. All right? Have I ever did that? No. And I've never seen a Maltese cross ever. I haven't seen it except in books. Okay?
Which way?
They're rare. I don't think she has, she hasn't told me about it. They're rare. Okay, so oval fat bodies, all they are is renal tubular epithelial cells that have lipid content on them. Okay, that's all they are. Out of the epithelial cells, the one that is diagnostically significant is renal tubular epithelial cells. So there's three types: squamous epis, transitionals, and renal tubular epithelial cells are the three types of epithelial cells that you can see. All right, page 118. Bacteria in the urine. Since we're talking about it, look over at page 119, look at picture A. That's what bacteria looks like in the urine. And yes, some of them look like dots and some of them look like rods, and you never report that out. You never report out, look, I'm seeing rod-shaped bacteria on it. You just report out whether or not you see bacteria. The giveaway on bacteria is that it's modal. You'll see them, they're moving. Of course, I can't show you that in these pictures, but if you look in a urine sediment and you see little things like this and dots or whatever, and that stuff is just kind of
Squiggling.
shimmering, okay? That's bacteria. Sometimes you'll look at a specimen and they will be loaded with it, and you would report that out as bacteria heavy. or bacteria 4+. Sometimes you just see occasional ones swimming around in there, okay? And then that would be occasional bacteria. Sometimes it's kind of in between and you report it out as moderate or 2+. You'll get a feel for that. That's all I can tell you. But I can tell you, don't go home worried about whether you reported out moderate or many, okay? Because they're gonna give the same medication if you say either one of those terms. All right, page 118, left-hand column under bacteria. Say they are not normally present in the urine. However, unless specimens are collected under sterile conditions, a few bacteria are usually present as a result of vaginal, urethral, external genitalia, or collection container contamination. Next paragraph, drop down about 3 lines. It says they are reported as few, moderate, or many per high-powered field. To be considered significant for a urinary tract infection, bacteria should always be accompanied by white blood cells. So if you're looking at a specimen and you don't see anything but bacteria, there's a good chance that, first of all, it's not a urinary tract infection, but there's also a good chance it's a contaminated specimen. Like it's been sitting at room temperature for a really long time and the bacteria started multiplying. A true urinary tract infection, you will see bacteria and white blood cells. Remember that. And then on toward the end of that paragraph, it says observing bacteria for motility also is useful in differentiating them from similar appearing amorphous phosphates and urates. That's a key thing right there. I don't think it's on your test, but it's important. Remember I told you, if you look at a specimen that's been sitting in the refrigerator, there's a bunch of amorphous that forms. It's like little sandy particles, but when you, if that's on your microscopic, it won't be moving. It just looks like sand that is stationary, right? But bacteria will be mobile, will be moving. All right, stick with me for about 5 minutes and we'll take a break. I just want to get through yeast and parasites and stuff. Okay, yeast on page 119 says yeast cells appear in the urine as small refractal oval structures that may or may not contain a bud. In severe infections, they may appear as branched mycelial forms. Okay, so here's what you'll see 99% of the time when you're looking at a urine specimen. If you see yeast in there, you'll see this right here. And I'll show you a good picture in your book, but it'll look like this. Usually it's one kind of decent sized circle, like that. Okay, that's what it'll look like. So that kind of a large circle and a little baby circle attached to it.
Babies.
That's like picture perfect. Now that doesn't mean that you may see more that look more like this. Okay, I mean they're gonna be close, but it's called budding, yeast bud. You'll see 2 circles together. If it's a severe infection, I call them tree branches. You'll see what's called the mycelial form, where now take this picture, you'll see a couple of these everywhere, but then all of a sudden you'll see stuff that looks like this. Okay, they're tree branches, they'll be everywhere. This is called the mycelial form, all right?
Pictures of
That's
that too.
yeast. You have to be able to determine yeast from red blood cells. Picture A on page 119 on the right side, that's a good picture of yeast. Picture.
But these
Yeah,
are,
oh, no, look on page 111. Turn back to page 111.
I don't think this looks
Look
anything
at
like
figure
this.
6-10 on page 111. That's what yeast normally looks like. Everybody see it? Figure 6-10 on page 111. See those cells, how they're budding? You'll see kind of like a big circle with a little circle attached to it. You don't see the mycelial form that often. Normally you're gonna see them where they're budding. But if you can't figure out whether that's a red cell or a yeast, you add a drop of acetic acid, red blood cells will lyse. Yeast will be able to withstand the acetic acid and they'll stay there. Okay? All right, let's take a break.
So the other day when he